Hey, this video is for scar mobilization work. So specifically for C-section scars, but understand that the science can be applied to any scar on your body. So if you've had a vaginal delivery or a C-section delivery, this is something that might be beneficial for you. Now, why is scar mobilization important? When you have a cut through your body, and this can be anywhere, scar tissue heals to try and merge those two sides of the skin. And scar tissue, that first layer that's laid down, is really haphazardly laid out and was really taut. So often what we see in a C-section scar is that the scar is really pulled into the body, and some people kind of feel like it's like a shelf, that it's not necessarily just chub, it's like you actually have scar tissue that's adhesing and pulling in towards the abdomen. So we need to mobilize this scar tissue progressively over time so that that scar tissue remodels into a more stretchy and more aligned collagen matrix. Okay, just to use some fancy words. So I want to first acknowledge the fact that when you're doing scar stuff or any kind of recovery around a C-section or perineal tear, there's a physical component that we want to work on. So sometimes there is sensitivity around the scar because your brain has been protecting this part of your body for at least 6 weeks. There's also sometimes numbness because we know that the nerve endings have been affected by an incision. And so we're sometimes working with both sides of that spectrum. And we know that there's restriction. So when you're talking about an abdominal scar, that scar tissue is pulling in towards the belly, but the scar was created through your tendons to your abdomen or abdominal muscles. And so it's really common to have tension around it. Then there's the emotional component of things. Not everybody wanted a C-section, and birth can be pretty traumatic. And so thinking about this part of your body might feel really uncomfortable. So I'm gonna lay out some examples of where to start and where you wanna get to. Where to start? Keep in mind that your breath and diaphragm, belly, and pelvic floor all move together. So if you're watching this and you're like, I don't even know if I want to think about this, my goal for you is place your hands on your belly or wherever you're working on and think about breathing gently in towards your hands. Start to visualize that part of your body. Start to see how you're feeling and use gentle breathing as a way to become comfortable with mobilizing the area just with your breath. You can't do much damage with your breath because you won't be able to push through anything forcefully, right? Go slow, go gentle. Then I want you to work right directly on the scar. So clean hands, make sure that there isn't any active healing still happening. So no redness, no bleeding, your stitches have been removed, it's been at least 6 weeks, X, right? Start noticing how, I'm gonna use my leggings as the scar example. Start noticing what does sensation feel like? What are the parts of your scar that you don't feel so comfortable with? Below the scar, above the scar. Those are all really important that we need to be considering. Once you've gone through that, I think just gentle holding on the scar or gentle movement on the scar is a great place to start. And you just want to desensitize the area. So gentle movement paired with light breathing, softening as you breathe out. Progressing from that, we want to start working on actually mobilizing. Now, I'm a very nice physio, and I tell people to use lotion or vitamin E or something like that you're used to, because that lack of friction can feel much safer. So if I'm telling you what to do, this is my scar. Option number 1 is gently drawing little circles on the scar, okay? Just moving through that as light as you want or as hard as you want. It kind of depends on what you can tolerate. I would suggest start light, see how your body reacts, and over time start pressing with more pressure. Option number 2, starting to work towards the scar. So I'm smushing down towards the scar. Again, the lighter I press, the more superficial the connective tissue I'm working is. The deeper I press, the more we're working through that scar, okay, and that depth of the scar. Option number 3, we're working towards pulling from the scar up towards the belly, pulling from the scar down towards the pubic bone, because we know that this abdominal tissue needs to be able to move in all directions. And so it's good to work on making sure that we're pulling in all directions and building up that tolerance and that capacity over time. So we have little circles, we have little smushies, we have little pulls, and working from using lotion to eventually not using lotion and just using that friction of your body. If it's been a long time since you've had this scar and you're kind of wondering like, I'm just missing a few pieces or I feel restricted when I do movement, don't forget that like mobilizing your belly is a super important piece to your belly being able to distend and lengthen and move with your movements, right? So move and see where your restriction is and see if you can breathe into it. Okay, so I just filmed this whole thing and then I like ended up having the speaker way too close to my mouth. So we're gonna do this little last part. I have one more thing I wanna do. So this is called like the pin and stretch, and it can be really helpful if you've made some progress with your scar, but like the connective tissue attaching to your hips and stuff is a little bit tight. So let's see how this goes here. Come lie down on your back. And I wouldn't start here. I would do all the other things first, but pin and stretch means you're pinning your hands onto the scar, and then if my legs fall towards the left, my hands are pulling gently towards the right, and then I come back, and then I do the opposite direction. This is really nice because your core needs to be able to move in all directions, right? And sometimes that restriction around the like deep abdominal tendons or even in that muscle is affected and stuck around that scar. So it's nice, it's like, okay, I want my body to go this way, but I need to be able to move this way. So a pin and stretch is a really good one. So remember, you can twist, smush, pull, and then pin and stretch. So a few minutes every day, first aiming for becoming friends, desensitizing that sensitivity, making sure you're giving it factual information of like, I'm okay, this scar is healed, this is just a lot of protectiveness, you know, starting to like come to terms with what is going on in your body, and then starting to work through the layers. Your C-section scar has actually 3 layers of depth and of adhesions, and so we want to be working quite deep. Working with lotion first, eventually without, and working on superficial layers and then massaging deeper and deeper. And eventually we're working through like quick friction. So there's lots you can do. These are all suggestions. Obviously, I'm not with you assessing your scar and telling you exactly where to start. So if you're watching this for information, wonderful, explore where your limits are, work within them. This is just some advice. And if you're like, okay, maybe I'm realizing I need help, go see somebody because it can make a world of a difference. Okay? Bye.